Yeah, I know. It's quite funny, isn't it, when you see what they come up with? I've seen that in meetings. It's going along the side and you can see it spilling up with different interpretations. Yeah.
Okay, recording has started, if that's okay.
Lovely.
With you. So if
Of
I ask you that
course.
question again, please could you tell me what health coaching actually means? I'd be grateful.
Okay, so health coaching for me is an approach and a set of skills where you aim to teach patients or clients, someone living with a health condition, how to look after themselves in the best way they can. So if you are a health coach, that's your dedicated job, and you focus on building the kind of self-management and self-coping skills of someone living with any kind of health condition. But you can also use health coaching, I guess those health coaching skills as any health or social or well-being professional. You might bring those skills in alongside your other skills like diagnostic skills of a GP or the sort of physical skills of a physiotherapist. So it can either be a standalone job or it can be part of a role for somebody's part of their other role.
Thank you for that. And how does it work within the wider framework of primary and secondary care?
Well, I suppose it depends how enlightened the services are, but if if you understand that the patient has a role to play, I'll use the word patient for simplicity, but you can use
absolutely.
client or
Yeah.
sort of, if you perceive the patient has a role to play, so let's say in chronic pain, if you do actually realize that the role the patient takes is important, then you would give some time and effort into making sure they're good at doing that. So I think in the best settings, either primary care or hospital care, let's say in primary care with something like diabetes or chronic pain, you see people employing health coach skills as a doctor, where they sort of like trade off with someone, look, there's stuff I can do for you, but there's stuff you're gonna have to do for yourself. And actually they can start them on the track of drawing their attention to it, and then often connect them up with someone that has dedicated health coaching time to really help them build those skills and capabilities. Same in secondary care. I've seen stroke services where they're looking at stroke recovery, or a secondary care chronic pain clinic, or people that are recovering from heart attacks, any sort of recovering from orthopedic operations, hip and knee replacements, and they will employ health coaches to build up people's recovery and their confidence and help them to sort of do all the things they're going to have to do for themselves. So it works really well in a range of contexts, but only if the system gets it.
Yeah, I think when my dad was alive, he had COPD, and there was an 8-week course just with other people with COPD, and they were doing like just little exercises on a little step and getting up out of the chair and stuff like that. And he really enjoyed it. And because he met other people like him and realized that, oh, he is quite capable, of doing stuff, but there's also people that are worse off than him in a way, sort of in terms of mobility.
Yeah.
And unfortunately, the course was only for 8 weeks and there wasn't any kind of follow-up.
Sure.
So I mean, COVID happened after that. So that was one of the reasons. But the other thing was there was nobody like checking in with him to see if he was still, like a 3-month, 6-month, yearly check to see if he was still keeping up, or he was still trying to get out for a walk and those kind of things. And that's something that the next question brings me on to, is how health coaching differs from social prescribing, because some instances of social prescribing, and I'll be completely honest, this is not necessarily for the article, but just quickly, some people's experience of social prescribing has been very difficult, particularly people with persistent pain and particularly people who've got rheumatoid or autoimmune conditions, because exercise is great, but only to a certain extent. It can actually make worse. And people have been pushed into exercise programs at a local gym, where the people at the gym don't have any understanding of, pain or what people can do, what their abilities are. And I just wondered how that, not all social prescribers like that. Some social prescribers are brilliant. They get
really clear on that.
And some don't, and I just wondered what the difference was between the two, please.
Well, I can give you the purest answer, recognizing that it's not always completely clean out there.
Yeah.
and I'd bring in another role, care coordination as well, which kind of comes into what you said about your dad. So
Yeah.
for me, health coaching is about building individuals' capabilities. So you're building a skill set, you're helping that person and perhaps their carer and their family, but you're building the capabilities of people to look after themselves. It's a very deliberate approach. It's a skill set focused on the person, and you're looking to upskill the person. Social prescribing, as I guess, is trying to create a supportive wraparound context for that person. So you're not necessarily building their skills as a social prescriber. That's what a health coach does. But a social prescriber might be trying to connect you with a very favorable context. So we know that if you're isolated and you're not supporting, you haven't got encouraging people around you, it's really hard, much harder to do the things, to look after yourself. So there's a great overlap. So in the best case scenario, a health coach will work, build someone's understanding their condition, their skill set, what they do to look after themselves. And then the social prescriber might then connect them with others like them that can keep that going and maintain it. I think the other role that is quite interesting, might have been good for your dad, is that role of a care coordinator. And I think they, again, sort of span, they sometimes use coaching skills. They're sometimes going to be connecting people to things, but actually they're often helping people just to make sense of all the different services, be they health services, social services, community, volunteering. Sometimes people get a bit lost in all this. What am I supposed to be doing, and who am I connecting with, and what appointment am I supposed to be going to? So a care coordinator can also be a bit of the glue when people have got a really complicated situation. So I think those three roles have a very distinct place to play. There's clearly overlap. I mean, the overlap between social prescribing and health coaching, I think, is group work, where you might be helping to build people's skills, your self-management of your COPD through breathing exercises and becoming fitter. And doing that with other people might make it, easy to do, easy to engage, more fun. So, the sort of teaming people together might be where social prescribing and health coaching overlaps.
That's a great explanation. And I think for people on the outside of the healthcare system, people like me, etc., it's very hard to distinguish who's who, because like you said, there's a lot of overlap and people are calling different roles different things.
Yes.
And so that can be difficult, but also in some of the group situations, this isn't in every situation, but I know in some pain cafes, the pain cafes are run by, say, somebody who used to work in public health and doesn't really understand pain as such in the wider context, other than wanting to look at, getting people more active and stuff, which is fair enough.
Yes.
But there's also this thing where people are saying, oh yeah, I'm recovered, or I'm cured, from some people who are running the cafes. And that's like a massive worry for a start, because it puts people under pressure. There's also that thing that also I've experienced in the waiting room, where people are starting to be competitive about who's more ill than the other, or who's on more medication than the other. And one of the worrying things, and a lot of things that we do hear about them, unless they're run by somebody who's lived experience but is also aware of the BPS model and has been through the system themselves, and is a bit more kind of empathetic, and also is a bit more honest about, you've got to put a bit of effort in yourself, sort of thing. There isn't any, there is some harm being caused by these things, where there's no necessary follow-up, and some people don't like speaking in groups. And there's also this thing of like, well, if you don't go to it, you're not trying hard enough.
Sure. I recognize all these.
Yeah, and that
leads
on
to
my next question. I know this is a difficult question, but I've also read your LinkedIn post, so I know you'll understand this. Is just as a thing, because a lot of people are frightened. And is health coaching just another name for social engineering, nanny provision, around getting people to conform to prescribe and often unrealistic health regimes in order to be healthier workforce?
No, I've got a perspective on this.
I know.
It can be, if it's done really badly, and I think the crucial thing here is locus of control. Who's determining what's important and what's needed? So a good health coach will start with a person and help understand their individual situations. Exactly as you said, you may find someone with an enduring inflammatory condition. They're never going to get cured of their chronic pain necessarily, and their situations around managing, living with it, coping with things, and getting more physically active is not necessarily going to be the right thing for them. However, there are other people with a sort of primary chronic pain situation where it is more of a pain processing problem, which we see, more and more commonly now, where actually there is optimism about things getting a lot better. And we're actually, graded movement and finding it, learning to feel safe to move again is often the key step in helping them to recover. Now, that'll be totally different for someone like you. That's not going to be the thing. So it is about locus to control. Who's in charge? Who gets to dictate what's important? And so a good health coach will follow that. So it won't be one size fits all. It's very personalized and it's very
Right.
focused around the individual.
Yeah. I
But
mean,
if you
that's the
don't do that,
important thing,
yeah,
isn't
it
it?
can absolutely turn into trying to push people into a box and to socially engineer people. And that would be the worst thing for me. That's not health coaching. That's really
But
poor.
some people do that. I mean, we do
Yeah.
have to recognize that out in the community. But it is, they are well-meaning, but
Of course they are, but they're just a
and
bit out of date, aren't they?
yeah, but it's hard to turn the tanker around, because there is a lot
Well,
of people who
that's the
think like
thing,
that.
isn't it?
Yeah.
We used to use doctors used to use leeches and bloodletting, and for a while that was considered, cutting edge. So, we do have to hold ourselves accountable to learning
Yeah.
and changing our practice.
Okay. So you kind of already explained it, but
Yeah.
how could health coaching help people living with persistent pain improve their own well-being? And I think from what you've said, you're very much recognizing that the person with persistent pain is an expert on their own pain.
100%. That's a great starting point, isn't it? Although,
Yeah,
of course, people have different confidence levels with that, don't they? Some people
yeah,
feel very overwhelmed and subsumed, and they find it hard to think about their own condition. So it is all about, for me, it's all about tailoring. And that's a peak health coaching. That's one of our big words is about tailoring or personalizing.
right.
So, first listen, understand where someone's at, their social situation, their own skill set. Some people are already incredibly skilled, and actually what you can do as a coach is help them to sort of navigate a plan that's already part formed. Other people are really overwhelmed and disengaged, perhaps at a lower level of activation, and what a coach's job in that situation, that they would tailor their role to sort of just making it feel worthwhile to turn up at all, or to sort of start to talk about themselves, or start to even just consider they could do something a bit better. So it is very individual and very tailored. But I personally think, for instance, chronic pain has been managed very badly because
Mm,
our understanding of it and the scope of it has been really poor. And health coaches are great at helping people to understand it a bit better. But there is a big role that people play to improve the management of their pain, at
yes.
whatever position they're at. And we know
Yeah.
that's so important. We don't have we don't have good medical interventions, but we do know that when people start to think and behave well with their pain, they can massively improve their quality of life. So I think health coaching has a huge part to play, but again, it will be very variable for each individual.
I mean, I agree with you entirely.
Oh, great.
But the problem, but
That's lucky.
the problem is, you know, our readers are going to know where and how do they access a health coach? Because, like I said to you before,
Yeah.
they're all called kind of different things. But where is the
Mm,
best place to go for some, in the first instance, to ask that question about where's a health coach? How can I access a health
yeah.
coach? I don't want to go to pain cafes.
No,
I don't want to be doing group stuff. I want to keep it
yeah.
one to one with somebody. Where do I go?
Sure. Well, it's good for people to ask for them because they should be able to have access to them now. So
Right.
we're in that slightly, when the NHS takes on something new, they
Mm-hmm.
often don't, there often is a bit of a postcode lottery. So they've
Yeah.
let GP practices choose whether or not they think they should have a health coach. So some do and some don't. So there's 1,000 health coaches across the country. So there's not enough for everyone to go around. Some places, some really enlightened places, there might be 4 or 5 health coaches in a GP network, and it would be quite easy to get to see someone. The waiting list will be low. Other places won't have one, and
Yeah.
actually patients knocking the door and going, look, I should have access to a health coach as an NHS patient would probably help drive the system. That said, the other side of the coin, there are private health coaches out there as well. So if you wanted to mention that, I would
Yeah.
recommend the UK International Health Coach Association. they have a registered list of people who they've accredited as a health coach. That guarantees a good standard. And there are
Yeah.
people spread across the country. I think they've got about 400 on their list. I'm one of them. I have a bit of a vested interest. Well, I don't really do a lot of private. I just did it to make sure that I was registered as a health coach, to go through the process really.
But that's really
But
important information, because that's the thing, isn't it? You know, even when it's like people going to like yoga teachers or something, they're not
yeah,
necessarily accredited with anything. So if you came across any problems, you know, you couldn't think. So it's good to know that there is actually an
yeah.
umbrella organization which
Yeah, I would
good
really trust
health
them. I
coach.
mean,
Yeah,
health coaching's still reasonably new internationally, and
sure,
in
sure.
the UK, and so the UK actually only going since 2018, but they're very a really good, robust organisation,
Mm.
and health coaching isn't a registered profession. It's not like, being a doctor or a nurse or a
Sure.
physio, where you
Mm.
have to have an official registration with a clear government standard. So, anyone could set themselves up as a health coach.
Sure.
They might not be able to get insured as a health coach. Generally, these days, to get insurance, you have to have a recognized accreditation. So the
Patient.
two
Yeah.
thing, I would check someone's on the UKIHCI list,
Yeah.
and check, have they got insurance for what they do. Those would be the two things I'd be asking people.
Insurance. Right. Okay. That's good, because that's really helpful. I know we're running out of time, so I'm really sorry.
Yeah, no, go for it. What's most
So
useful?
so you've said who monitors the efficacy of health coaching in a way, haven't you, by answering that question? But I
Yeah.
suppose in some ways it's the actual patient themselves. Um,
Who does what? Who monitors the effect?
yeah, the
Yeah,
effectiveness and
absolutely. Yeah,
the
yeah.
efficiency. Yeah.
I would say that. And I mean, that's been one of the problems with health coaching, is because often, if you were testing a drug, you'd have a random placebo controlled study. You'd have a really clear, does it reduce the blood pressure? Does it change the pain? You would have a really clear set of parameters, and you'd be comparing one tablet with a placebo. With health coaching, there's two problems really. One is that it's a different thing for different people. So
Yes.
you can't always test a completely same apples for apples. And also, like you say, what one person considers success will be somebody else. So I completely agree with you. What we should be
Mm.
doing is asking people to sort of almost say up front, what are the things you want to work on, and what would be a marker of success. So
Yeah.
as an
That's
example,
it.
someone that I was coaching with recently, and lots of things that she wanted, but actually in the end it was having more energy at the weekend to be there for her daughter. And
Oh,
so in a
okay.
way it was like, sort of, because lots of other things were in the way, sort of
Mm.
like,
Yeah.
job pressures, work pressures, all important things and things she wanted to
Sure,
do, but she
sure.
just felt her life was out of balance. So that was the thing that she was holding herself accountable to. So in a way, you could almost say, out of 10, how are you going with that ambition to have more energy
Mm.
for your daughter at the weekend? It's like you set your own parameters, and then you try and work out, has it worked for me or has it not? So I should be very patient led, I would say.
That's great, because I mean, one of the things that we say, because I think when people say, oh, you can be cured if you come on this and you're going to have recovery, that's different things for different people. And for that lady, being able to spend time with the daughter is a form of recovery for her, because it's given her
Completely.
quality of life and better well-being. So that's really important. I mean, we always say, what do you enjoy doing?
Yeah,
What did you used to
absolutely.
enjoy doing, and how can we work around it to get you back to enjoying that in a different way or the same way or whatever? I mean, that's one of the key things, and it kind of leads
Yeah.
on to the next
Well, and I,
question,
I wanted
which
to just add to that about, because I
sure,
know
sure.
you're with Connect and Flipping Pain and the six, sort of principles of pain management. And it's in all this, we use that a lot actually, and we've used it a lot in our pain cafes that we've set up. And that
Hmm.
last one, recovery is possible, always
Yeah,
creates the most contention, just as you've said,
sure.
because recovery is different for different people, isn't it? For
Absolutely.
some people, it might be, getting rid of the chronic pain and just having acute pain again. No one's ever not going to have any pain in their life, but for other people, it will be making it more manageable. For others, it will be accepting the pain's never going to change, and you're going to grow other things in your life. So what recovery means to you will be very different, won't it?
Yes, I appreciate we're running out of time, so I'm not going
Yeah,
to ask you about the health
go for it.
conference one, because that's obviously,
Yeah.
but is there anything else you would like to add that you'd like our readers to know
I
about
just
in
think
terms of
it. I mean, I am a bit biased by health coaching, but health coaching benefits benefits patients. But the other thing is that actually it's a lovely way of creating a positive relationship. Again, I think a lot of what's happened in healthcare is pitched care, sort of professionals against patients, but your question about the nanny state and trying to push people into a box, GPs are rushed, they want to get people out the door, they're sort of like, so, I think the dynamic of health coaching reestablishes a positive relationship for everybody, and it doesn't have to take time. Do you know what I mean? I always say you do as much health coaching as you've got time for. So if I've only got 10 minutes with someone as a GP, I might only have time to ask one coaching question, and it might be something like, so what are you doing to look after yourself at the moment? Do you know what I mean? And they might sort of go, well, oh, that's your job, isn't it? I go, yeah, well, it might be, but is there anything that you think you ought to be doing? Do you know what I mean? That would be my only coaching intervention, because it's sort of implying that actually there would be benefit in them thinking about something to do, but I'll leave it there, knowing that that's a coaching intervention.
Yeah.
If I've got an hour with someone, which occasionally I do, or 45 minutes in a pain clinic, then I know I can do a completely different sort of thing. I can understand what's going on for them. I can start to ask them about what they would like to aim for and start to explore their ideas. So I can have a different coaching conversation. But the dynamic is that I believe in the person, and I think it's worthwhile building their skills rather than just me telling them what I know. And I think that's it changes the relationship, and that's lovely for everybody.
I think that's really important. I'm so glad you said that, because in a couple of the workshops I attended, and some of the things that people said were a bit worrying in the terms of, well, I think one said, oh yeah, well, I get them to accept their pain first of all. It's like, really? Oh, crikey. Well, then I work on from there, and I'm thinking, oh my God, no. But, different strokes for different folks.
It's a journey for all of us, isn't it? And I recognize, every practitioner has to go on their own journey as well, and I think the best health coaches are the people who innately get the power dynamic and know it's their role just to big up the person as much as they can. So saying things like, I get them to do that is really about them, isn't it? Do you know what I mean? It's about them feeling good about themselves.
Yeah, so absolutely.
We in supervision and in sort of, for reflection feedback as a company, we try and get people to think about that. But it's not always perfect, and it's a journey.
Brilliant stuff. I appreciate your time. Thank you so much,
I better
Ollie.
jump off.
I'll make sure you shine through this. Don't worry, because you always do. And we're always grateful for your help and your participation and everything. And hopefully catch up with you after your holidays and have another conversation sometime. Yeah, you keep in touch.
Brilliant what you're doing, Fen. Thank you. I really appreciate it. Cheers.
Take care. Thanks again.
Bye.
Bye.